Welcome to Gallery of Smiles. My name is Dr. Justin Emami, and I'm joined by two lovely women in the medical field. Stephanie, who's one of our lovely hygienists here at Gallery of Smiles, and Dr. Bilbruck from Results Medical Spa here in Tulsa, Oklahoma. You know, it's so important to have cleanings, exams, checkups. Whenever it comes to the mouth itself, there's a huge connection between health, the mouth, and everything that is entailed there.
Exactly.
What do you ladies think about that?
Well, I think that is one of the reasons why it's so important to have your annual cleanings twice a year, not only for your oral health, but also for your overall health.
Exactly. Yeah, and gum disease causes inflammation, and as we know, the source of most ill health is rooted in inflammation. So what you guys do is very important.
Well, thank you. Thank you. We appreciate that.
Yeah.
And what you do is very important as well.
Thank
Dr.
you.
Bilbruck, tell us a little bit about yourself.
Well, I've been practicing medicine for a little over 20 years, and about 10 years ago, I had a dream to open a medical aesthetics clinic. So in 2012, we opened Results Medical Spa, and now we're next to you guys. So we love partnering with you guys because, as we know, a beautiful smile surrounded by beautiful lips and healthy skin is the full package, right?
Oh, definitely.
Yeah.
I agree. I agree.
Yeah, but as an internist, what I see is a lot of people with gum disease affecting their heart and affecting other areas of their body. And I know you guys see the other way around. People without good teeth can't get good nutrition. Dangerous to let your teeth go.
And I think what people don't understand is how the oral cavity is all connected with the overall health. And
Right.
so, and there's been so much research showing that not only with heart disease, but with other systemic diseases as well, that cause, all stemming from inflammation.
Right, there's some really interesting stuff about Alzheimer's. I mean, nothing's set in stone yet, but we're all starting to worry. Well, the gums are so vascular, right? And that feeds into the same, overall system that everything else does. So,
Definitely. Yeah. All the bacteria is connected, and we want to make sure that
Yeah.
the whole body is taken care of. And that's why here at Gallery of Smiles, we believe in total health.
Yeah.
Not just looking at the pretty teeth, not just making them look good whenever you smile, but really making sure that your body has the ability to fight this inflammation, getting rid of the bacteria that's, hiding in between every nook and cranny that we have in our mouths. Of course, it's not the only factor, but it's definitely a huge one. for sure.
Right, I agree. We always say healthy people are pretty people.
Dr. Bilbruck, why don't you explain to us your experience for treating patients with disease, with active infection, periodontal disease, things like that?
Well, there's several fold on that front, right? If you have poor teeth, your nutrition is poor, and that makes it difficult. But I see a lot of my diabetics who have trouble getting their A1Cs under control, and I can't help but wonder when they have periodontal disease, or if I have somebody with fever of unknown cause, and I look and they've got rotting teeth or gum disease, I know that that's going to play a part, right? Because it's inflammation. Inflammation fuels underlying difficulties with metabolism and with controlling sugars. So that's a problem. Some of my patients who are on biologics for say, rheumatoid arthritis, an infection is a clear indication to stop those biologics. And one wonders, gum disease is a serious infection as well, especially when they have to come see you and they have to, have teeth extracted. God forbid we get to that point, but it's important. I mean, it's difficult to have a healthy body when you've got a raging infection, whether it's a diabetic foot infection or gum disease. It's all the same, right? It affects the body. So.
Right. It's definitely unfortunate whenever we have patients who come in here who do have diabetes, and we talk to their medical physicians. Yeah. And their A1Cs are out of control, and they have this active infection in their mouth. And it's so important to get out there to the public how important it is to keep both
Yeah.
your health of your mouth in order to help the health of your body, keeping those correlated and making sure that patients are getting the treatment that they need before we pull teeth.
Right, exactly.
You don't want to do that.
I know gum disease is so stealthy. You don't see it like you do cellulitis. You see a big red, streak coming up your arm, you've got an infection. But with gum disease, just because your gums bleed when you brush your teeth, you don't realize that equates to infection necessarily.
And that's why we call it the silent killer, because it's definitely too late whenever you start realizing the problems with it. Stephanie, why don't you tell us some of the issues and things that patients start seeing, and kind of helping guide patients to say, hey, get in here, it may be too late. What's your thoughts on things that you see?
Well, and I think probably what's most important that Dr. Bilbruck was mentioning earlier was People don't realize that bleeding gums is an infection. And I always like to tell our patients that if you had, tissue or any place on your skin that was bleeding chronically, you would go to the doctor because you would think, why is this not healing? And so many people will say, well, my gums, they just bleed all the time. And they don't realize that gums are tissue, and that is not a healthy thing. That is a disease, and we call that gingivitis. And sometimes if you let that go untreated for a long period of time, that then turns into a more aggressive form of gum disease that we call periodontitis. The reality is the gum disease in general, even though we have the bleeding, a lot of it is asymptomatic, meaning we don't have a lot of symptoms, and so people let it go untreated until it is very far gone, to where we're hopeful we don't have to lose teeth. And the good part of it is that it is a very treatable disease. And so that is, again, why it's so important to come to the dentist twice a year, so we can catch it early and move forward and maintain where we're at.
Great. I couldn't agree more. Yeah. Dr. Bilbruck, do you recommend to your patients to make sure that they come see their dentist regularly?
I do. I think it's really important. It's an important part of the whole package. And culturally, we've always separated oral health from physical health. It's always struck me as odd because we don't separate kidney health from regular health or heart health from regular health, right? But yeah, it's very important, particularly for my diabetics or people who are immune compromised. I think having a regular cleaning, because I got to tell you something, I'm no expert when it comes to the mouth, and I can look, and if it's stage horrible, right, and I see rotting teeth, then I know, but I'm not a dentist. So I really appreciate being able to partner with you guys so that you can look at their oral hygiene and their oral health and do that part of it.
Yeah, and I think it's so important, and it's all really inspiring that I feel so much of our healthcare has separated the oral health from the rest of the body. But what I love is that I feel the more research that has come on, the dentist and other doctors like we're doing today are coming together, and we're going to work together for the better of the patient, and it's just really exciting.
Yeah, I think the direction that healthcare is moving in is holistic healthcare. I think people, the general public, is starting to understand that it's about not disease but about optimal health, and it's very difficult to have optimal health if everything isn't working. You can't expect to just roll out of bed at 50, right, and have everything work. You got to do something. You got to get in the gym. You got to eat right. You got to sleep. You got to take care of your teeth. You got to have regular checkups just to see, because things like hypertension or gingivitis don't always show up in the mirror.
Absolutely.
Dr. Bilbruck, you bring up some good topics. Is there a list of correlating diseases that you would kind of tell the viewers of what they should be looking for if they have specific diseases that could be correlated with gum disease, gum infection, things like that?
Well, any source of inflammation in the body, one wonders where it's coming from. So definitely looking at oral health makes a difference. There has been some evidence that possibly bacteria that enters through the gums can affect the heart and the heart valves. That's not super common, but when they have done autopsies on people, they found some of the same bacteria that we know is responsible for periodontitis in the heart and the heart valves. So, that's always a concern. It's not super common, but it does exist, and certainly something that can be very, very dangerous if it does.
And very treatable too.
Yeah, right. And that's the thing that I wish people would understand, is that it's not that difficult to treat. You just got to stay on it. Now my understanding is you guys have a treatment to actually bring down the bacteria count in the gums.
Other than the traditional flossing and brushing and the use of mouthwash, which is still always so important, we also have trays that we can make for the patients that go into the sulcus, and we just put some medicinal gel in there, and you wear it 15 minutes a day, and it really changes the microbiology of it's from something negative to something positive.
Right. I was so excited when you told me that.
Yeah.
Especially when you told me that the best thing to do is put it on in my commute to work.
Yes. Yeah. It does.
What a brilliant practical option.
Yeah. There's so many ways that we can take oral health to accommodate our lives and our busy schedules, because we are always so busy.
Oh my gosh, isn't that the truth? I know. I have to confess, I was so excited. I love that you give me practical tips.
Yeah.
on how to sort of weave things into my day, because we're all busy.
Yeah, and we have to keep it realistic.
Yeah.
You know? We always have the optimal thing to do, but we have to keep it realistic.
15
Otherwise,
minutes a day.
you know, if we're not, if we give somebody this total package and we say this is how you're going to be the healthiest, that is great. But if you're not going to be compliant, then we're not really helping, are we?
Right, and I love the trays. Okay, and so here's what I have to confess about the trays. I'm such a fluff. I really love that they just make my teeth whiter.
And they do. They not only make your teeth whiter, but they can make them less sensitive, which is so important for people. You know, so although all of us are really concerned with our overall health, like we said earlier, we also want to look pretty. We want to have confidence, and I think with confidence comes more concern for our overall health.
Yeah, it's such a bonus though, I have to say. And honestly, for some people, I think that is a huge selling point.
Absolutely.
Stephanie, why don't you tell us a little bit more about overall health and oral hygiene?
Yeah, I think it is so exciting that we are giving more notoriety, should I say, towards the overall health and the overall correlation with the oral health. Because for years, we've always known that there has been a correlation with patients that have been autoimmune compromised or have had knee replacements or heart valve replacements. We've always pre-medicated them to prevent them from getting bacterial endocarditis. And so now I feel like we're just really giving it more importance and realizing that these things can be very harmful to our overall health.
Right, yeah, prior to oral work, pulling a tooth, cleaning, scaling and root planing and stuff, people with murmurs very often will get a pre-treatment with an oral antibiotic.
Absolutely.
Right, we've been doing that for years, and I know that there are some doctors that even recommend if you've got a knee implant or breast implants or anything that you pre-treat, because we don't want those areas to seed with the bacteria that comes from the gums and develop an infection in, say, a knee implant, so that then that implant has to be removed, because that all of a sudden starts being very invasive, very expensive. And we know we can prevent it with just a simple oral antibiotic.
And the reality is the bacteria in our mouth we're always going to have, but we want to try to change that bacteria into a more positive one, because the reality is we always keep ingesting the bacteria, and that's how it's all related.
And good bacteria, right? A healthy microbiome, whether it's in the mouth or the gut, is what we strive for.
Yeah,
absolutely. Which is why I'm so excited about the trays, because
yes.
I think that really helps take down the bad bacteria and then let you recolonize with the healthy stuff.
Absolutely.
You know, one of the things I think is most interesting about the microbiome in the gut is that we actually have these places called Peyer's patches, and Peyer's patches in the gut are filled with friendly bacteria, and that's what helps us absorb our B vitamins. So we're learning more and more all the time about how important the microbiome is, whether it be in the mouth or the gut. And let's face it, they're connected, right? The alimentary canal starts at your lips and ends below.
So let's talk about pregnancy. Of course, you ladies both have children. Why don't you guys give us some information about, the correlation between oral health and the body itself?
Well, one thing about pregnancy that it's not even a medical thing is that our diet starts to change because we start to eat more frequently, but also as the pregnancy gets further along, you can start getting things like acid reflux. Yes, and that acid reflux will then, again, come up, and we cause acid from the acid reflux into causing erosion of the teeth. And so again, it's all those little things that are always, combined.
One of the things we see, not just pregnancy causing acid reflux, but obesity and just in general, some people have acid reflux, and that I know affects the teeth. I know what we do for it in healthcare, but what do you guys do in the dental world? I've often wondered.
Right, and in dentistry, we don't do so much about treating the acid reflux.
Right.
We leave that to you guys.
Yeah.
But what we try to do is prevent and protect the teeth from the acid reflux, because that acid is going to erode the teeth and essentially, can end up taking the enamel off of our teeth, is what it does. And then that in turn causes sensitivity, and you're at risk of getting cavities.
There's so many patients who don't even know that they have acid reflux or GERD or other issues like that with the stomach. But we have had patients come in here, and we're able to identify some of those signs and symptoms that patients are having by looking at the mouth itself, by looking at the teeth, by looking at the gums and the foundation. And at that point, we're able to provide recommendation to seek care or to discuss this with the primary care physician. And this is another correlation, both where the teeth affects health and the health affects teeth. That's really important. And it's helped so many patients figure out, wow, I have been having a problem. And just by looking at the mouth, we are able to identify those type of things.
So I know, Dr. Emami, that oral health, also cancers of the mouth and tongue and oral mucosa, a lot of smokers, who knows what vaping does, and tobacco dipping are real risks. And I know in my profession, I generally send people to you. So what are you seeing with that these days?
Yeah, whenever our patients come in, they actually don't know all of the details that we take to make sure that we're not just looking at broken teeth or gum disease and things of that nature. We actually do oral cancer screenings at every single visit. One of the services that we provide here is called Velscope. So basically, this is a simple lighting technique that we use in the mouth to evaluate the gums, the tongue, pretty much every area in the mouth. There's so many signs in the mouth that happen before the cancers can really become aggressive that we're able to view as dentists first. And kind of how that process goes, because I know that we've been discussing this, is whenever we take a look in the mouth and we see that there's signs of smoking or dipping, we evaluate the gums, the textures, kind of how they look.
Right.
And at that point, we recommend looking at getting that area biopsied or looked at, whether it's with an oral surgeon or we do the biopsy here. Kind of depends upon what we see. Then at that point, we're able to get further information. So if it's something that's, not really anything going on, thank the Lord.
Yeah.
But if there is something going on, that we're able to address this in the beginning versus addressing it in the middle or at further stages whenever it comes to cancer.
Yeah, and especially head and neck cancers. I mean, they are malignant and terrible. And so just like with mammogram, I always tell my patients, I don't have a mammography machine in my office. I'm going to send you out. So for my smokers and people that dip, I send them to you for the same kind of screening. Because as you know, if you wait until you have to start removing the lip or the cheek or part of the jaw and radiation, it's a serious concern. So I mean, that's one of the things I appreciate most about what you guys can do to help my clients.
Yeah, no, and we appreciate you understanding that and sending them over to us, because we can stop things in the beginning.
Yeah.
And that's amazing. That's saving a life.
It is saving a life, absolutely. And thank God you guys have the technology to do that, because for us, it's, a flashlight in my eyes, it's about as helpful as a digital, a breast exam versus a mammogram. I mean, it really is about the technology. I think that's something I don't think people realize, that when you go to the dentist, it is exactly a lot more screening goes on than you realize.
And we're very thankful that you appreciate that, and we want to take care of people. Again, ladies, thank you so much for coming today and discussing these important topics that so many people don't know about or just needed more information about. And of course, if you'd like to take a part of Dr. Bilbruck's services right here in Tulsa, you can look online at resultsmed.com. Also, if it's been a while since you've had a checkup or some of these topics interest you, feel free to ask the staff here at Gallery of Smiles, or go online at galleryofsmiles.com to get more information. We are here to take care of you, and we take your health very seriously. Thank you so much for listening.